Welcome to the Dr. Franken Steve Podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome. This is the Dr. Franken Steve Podcast. I'm your host, Frank Williams, and this is Dr. Steven Snodgrass. Today, we're going to be continuing with our discussion on the arts. Today is a little different take because we're going to be covering art therapy and the healing effects of arts. So without further ado, I'm going to let Steve go ahead and start off telling you what art therapy is about and how it comes together and why we're doing what we're doing to push it, to make it mainstream, basically. So, Steve, dressed like a rock star as normal, so I'll go ahead and let you, now you're going to a funeral. So I'll go ahead and let you,
it's a casual funeral.
It's a casual funeral, okay.
So this one is very interesting to me because I'm going to kind of go about it in a roundabout way to get to the point, but as a surgeon, basically us compared to a lot of different specialties, what we do is extremely invasive. I mean, that you look at, like a lot of times when you go see your other doctors, like your family doctors and your internists and things like that, there's no invasive procedure per se, but cutting your belly wide open is an invasive procedure.
I would say.
Yeah, and so the other thing too is that as surgeons, we have so many different elements of patient care that we have to pay attention to in the physical realm. And what I mean by that is the fact that, yes, we're going to open your chest a lot. I mean, for me, open your chest, open your abdomen, literally cutting you from stem to sternum and sewing you back up and getting you back to your life. And so much of it is focused on the physical aspects of healing, because if you look at comorbidities, which like you never, I'm not going to say never, but hardly ever would you operate on somebody who's like 21 years old, completely healthy, and all they have is a hernia. I mean, to get something like that, you hardly ever did. And you would actually call another surgeon and say, like, look, I actually have a patient here that is not just got all kinds of different diseases and everything. It's just so refreshing to operate on a body that's otherwise healthy except for what you got to fix. And what I mean to that is, like, so many times, like, for example, it's countless. You would have a patient that would be maybe 5'2", 5'3", weigh 250 pounds, have a history of myocardial infarction with a coronary artery bypass graft, diabetes, smoke, and then have gallstones. So you got to take the gallbladder out, but then you have to address, well, they got heart problems, they got diabetes, they got lung problems. All of those things add up to a poor outcome and the wound not healing. And so you have to focus so much on the physicality of all that you kind of get lost in their emotional and mental state. And since I've been doing this, since I've become an artist and looked at the benefits of art therapy and exactly what that does, it bleeds into the physical aspect of it too. So there's a physical component and a mental component where the art therapy helps. And it's not just drawing a picture or anything like that. Art therapy is its own kind of specialization.
Right.
And, you know, like an art therapist can get a lot out of the patient. A lot of times, especially like in kids or people who have mental disorders and that sort of thing, they don't want to express themselves verbally, but they will physically through their art. There's a lot that can be gained in the interpretation of the art therapist of their art, and all those kinds of things can be used as tools to help patient care.
To help with the healing process.
Yes, absolutely. And I think that that is becoming more and more commonplace, but it's just vastly underused. And I think that especially surgeons, we're so focused on that physical part because we have to be, because it really, for us, it's just like, we probably know you're not all that happy, because you've got a massive cut on your body that hurts. But, if that wound doesn't heal, then you've got a lot more problems than what you came in there with.
And we'd rather you concentrate on your skill set and not be thinking while you've got somebody open, I wonder if this person brought their sketch pad when they get back to their room. That might help. No, we don't. Know your role, stay in your lane.
Yeah. At that stage, it's only like IV morphine.
Yeah.
It doesn't, there's.
Hey, they might get Sotheby's or Christie's if they come up with something too bizarre.
What I found, that was really interesting is like, this goes back a long way. And I think it's been used in VA hospital systems more so than anything else, just because of like PTSD and combat experience and that sort of thing. Yeah, so I think that obviously it has a very valuable place there. But one of the things that I read about that I thought was interesting was that one of the original art therapy was the Rorschach test. And, with the ink blots and all that kind of stuff. And that was done, a long time ago, in the 20th century, I think, something like that. But from what my reading showed me was like in regards to looking at who may have schizophrenia or that sort of personality disease, disorder, whatever, that is still today one of the most predictive tests that can be used. So it's still like in what's called the DSM-5. DSM is a diagnostic and statistical manual for psychiatry, but it's survived all of those years and it's still a useful tool considered by many. And so I think I've probably failed the Rorschach test. As a matter of fact, I did a painting and it was kind of bizarre looking, and my son just said, hey Dad, what's the name of that painting? Because sometimes I like to do serious titles, sometimes I like to do whimsical titles.
Yes, I know.
And so my son said like, hey Dad, what's the title of that painting? And I looked at it and I just said, Daddy failed the Rorschach test. And he said, yeah, I can believe that.
That'll help with the committal papers.
So anyway, I thought it was pretty, and I know it's interesting to look at this from a physician and a non-physician standpoint, because I'm biased more towards the whole physical aspect of it, but I'm getting more and more. Now, don't get me wrong, I had sympathy and I had empathy for my patients. I know they hurt, and I knew they would get depressed, and I would do my best to try to deal with that as well. But mostly I was just focused on getting that wound healed, getting them back out of the hospital on their feet again. But now the more reading I do, it just shows me, I put together this thing about it decreases it's been shown, the art therapy will decrease the use of pain medication, sleep medication, length of hospital stay, and hospital readmissions. So I put together a model. I don't want to go through all of them because there are a lot of numbers involved, and I never really liked math that much. I did a lot of other stuff in the sciences, but math was not my forte. But anyway, so I had a really good friend of mine who's got a PhD in math. We went through this thing together, and just conservatively, using art therapy in patient settings, and it also just improved patient outcome and quality of life, which are things you can't overlook. But it saved conservatively $105 billion a year.
If it's done as a nationwide standard of practice, correct?
Right. The thing about it is, if you take the art therapy and you can decrease pain medication uses. I mean, there's all kinds of, people don't think about a lot of what goes into pain medication. I mean, it can be addictive, It can affect your mind, and a major problem with pain medication is constipation. And constipation with a fresh belly incision are not really good companions. So just little things like that, but they're not so little when they happen to you. That's one of the things that I think that we drive home in all of this is like there's really no small procedure or anything when it's you.
Right, yes, anything is major.
Yeah, because you can talk about it all day long, but when it's you finally on that gurney, it kind of gives you a reality check, you know. And I can't stand being a patient. I can't. But I'm
No, most doctors are horrible patients.
yeah, I would qualify.
I shouldn't say horrible, most doctors are horrible patients, yes.
Yeah, I would qualify for that.
I've known several, yes.
So what do you see, like, from your standpoint, just looking at it from the outside looking in I mean, I know you have an incredible background because, I mean, you've seen a lot of things out there in the field. And so, I mean, you understand how these bodies are broken and they have to come to us to get fixed. Whereas I don't see it in the field outside of the hospital, and you don't see it so much in the hospital. So I feel like together we have a very good blend of what we see. So what's your interpretation of it from your standpoint?
Well, a lot has to do with the mental health aspect, and what I've always thought is you need a metaphysical approach, which is both the mental aspect and the actual physiology of the healing process, because you go on the scene of an accident and you have to notify somebody's next of kin or who you can get a hold of that this person just died. And maybe it's their birthday that day or the next day or whatever. That family's going to go through some major trauma. Maybe the person has a severed limb, and this is to the extreme. It could be a van load of children. You don't know. Maybe just the one person that survived. There's a lot that still needs to be in the hospital for, several weeks. There's a lot that goes into when you're at those scenes as a first responder, which, Steve and I are big on our donations and our support of all the first responders and obviously the military. And we always thank you guys for that. And being a former first responder and also a U.S. Army veteran, we have the utmost respect. That's why we try and help out with charities that take care of them. But it doesn't matter who you are. I've seen other officers actually break down and cry at scenes, almost go into shock because of the horrific incidents that we see in the field. Now, granted, not everybody sees that, not every city sees that. As we used to say as a police officer, or even in the military, you hope you don't get called to duty where you have to pull your weapon unless you're a complete psychopath and want to do that. But otherwise, you don't want to take lives. I mean, from somebody who's had to do things both in the military and in law enforcement, there's a huge trauma after you've been involved in major incidents that a lot of people don't realize. That's why they usually send you to get, a psychological evaluation. As I've said, I've had about 7 and I passed them all. So maybe, that's
This says a lot right there.
Yeah, that does. What ends up happening is a lot of times people either stress out, which means they have to retire on a stress medical, or they have to be assigned somewhere where they're not allowed to be in possession of anything, they can do harm to themselves, to the general public. But looking at that, you can see at the scene a lot of times, people are grasping for something to connect onto, not just for that very moment, but for the future. And if you do any follow-ups or as we go to do follow-ups, maybe to check in on the victims or the family or the detectives would, you're kind of interested in the case because we don't always have time. Like I'm sure happens in surgery where you've got so much going on that you don't have the time to put into every patient. Then as the patient leaves a little bit, you expect your staff to kind of follow up and then get you in touch with them. However, there's such a need for some type of therapy. A lot of people think there's a stigmatism into going to, counseling or grief counseling, or, whether that be secular, whether it's a Christian style counseling, no matter what, people really have an issue with that. But if there's a way for them to use energy and expend it in a creative way, and it doesn't matter if you think you can draw, if you think you can quilt, if you think you can play music or write music or whatever, write books, whatever it might be, poems, doesn't really matter. Art encompasses anything that is creative. And so and looking not from the physical standpoint of a surgeon or a medical professional, you can actually see where doing some type of not just getting in a group and talking, nothing wrong with that to my psychiatrist friends and the ones I train so they don't get mad at me. But sometimes people are so introverted and isolated. We know, and I know, I've seen it, where they just need someone to talk to, and then they need some way to express that when there's no one around to talk to. And what greater thing to do than start some type of creative art therapy, which not saying that every hospital, and this is just from my viewpoint, from all the research I've done and the people I've talked with professionally and then non-professionally, is that as we get going, we would like to see something that's standardized across the world, not just for, this individual medical facility or organization. American for the Arts does a great, great thing with their charity and what they do to try and help with soldiers and PTSD and trauma. So we give them a lot of props for that. But there really needs to be something that binds the medical field with not just veterans and first responders, and also bring in the citizens or circular version, which are non-military, non-first responders. If you can bring all of it together, standardize it on what works, and maybe do some double-blind studies, get more research out there, make it basically where it would be
usual and customary.
Thank you, because I always mess that up.
You want it to be part of usual and customary
Yeah,
care.
so then we know that, hey, insurance is going to pay for this, or your spending account's going to pay for it. Medicare is going to help pay for this, or Medicaid, whatever the case may be. But if there's a proven method, and not just under one facility, which helps, but if it's an actual drawn out program that has not just the beginning, but the middle and the ending, which is what Steve and I have put together to help with this, and is why we're pushing it so hard. Then you get local politicians, state, federal, you get congressmen, senators involved, and you get the president involved somehow to make sure that this becomes
usual and customary.
Thank you, Steve.
There you go.
And so that way, even if somebody's a little hesitant or apprehensive because they're not really hip into art or don't think that they're artistic, it's nothing for someone to just sit there. And I've done this with friends who are going through med school. I've done it with friends who are deployed overseas. And yes, they have videos, but there are some areas where the guys can't really do a lot of video chatting depending on what they're doing. So what I told them is to buy a journal. If you don't do anything else, if you want to scribble in that journal about like a daily log, and then write this journal to your child, to your fiance, hopefully you keep your fiance, to your wife, your parents, brother, sister, whoever it might be. So you keep that journal as you go along with your tour of duty or time away from them. That's a very beautiful gift to present to somebody as you return or as you get back. But that also is a creative way to let go and let them express. They can draw in it, any of those. So those are some of the things that I do, which is why when Steve and I got together, our ideas and the way that we look at things mesh so well together. And we said, why can't we do this on a national level? I know when my daughters were sick, they were very little, but sitting around a hospital forever, not just as the patient, but as a family member, you're really stressing a lot of times. And if there was creative ways to not just get the patient, but the family involved, whether it be through imaging, group chatting, the kid draws something up or does something that's creative, whether they can make it to a group setting or whether it's individualized with the art therapist going to their hospital room for a short time to see that patient and help them to be creative, even if it came down to the volunteer artists in the areas, in different areas, from music to art to sculpting, whatever it might be. Those programs can be all set up as one model, kind of like Steve said about saving and saving
105 billion a year.
So about 1.2, 1.4 trillion over 10
years. Yeah, and see, those were very conservative estimates, because the way that I did it, I set it up like, I got the data from like National Institute of Health, Centers for Disease Control, certain organizations that keep hospital data. And so those are conservative estimates. And the other thing too that I think is extremely important, that this was done, this study was done, it had a limited number of patients in it, which is some of the drawbacks of all this. We need studies, as you say, prospective, randomized, double-blind studies,
Yes.
with more patient populations, and then the patient populations are suffering from the same kind of thing. So literally you can kind of compare apples to apples. But one of the things that is a constant that I found very fascinating, when there's different indices and different objective, quantitative methods to look at some of this data. But what the studies have been showing is that if you're going to have surgery, like the day before or the day of your surgery, your anxiety levels are just through the roof. So, and you understand that whether if you're laying there in that gurney and somebody just says like, "How you doing?" You go like, "I'm fine," but really you're going like, "I'm not."
Yeah.
I'm not, or I wouldn't be here. But you just try to make the best of it. But then what I found fascinating, and this was in surgical patients, was that their level of depression was highest at 6 months post-op. So that's quite a period from the pre-op. I mean, you're going to have a lot of anxiety yourself because you are going to know when your symptoms began. And so you're going to say like, well, I wonder what this is, because there's something not right. And so there's some anxiety producing problems right there. And then when you finally go through that whole process of going through what may be wrong with you, to the point you find out what is wrong with you and how it's got to get fixed, there's a lot of both physical and mental drain on you right there. And then not to mention, when you're having to undergo a big operation or something like that, every system is involved. So the great thing about art therapy, and I read another study, it was from women who were suffering from a cancer diagnosis, be it breast cancer, ovarian cancer, uterine cancer, but they kind of had one common theme. They identified themselves, when they were getting treated, they identified themselves as cancer patients, and their friends and family identified them as cancer patients. And so, like one lady said, it just, speaking for the group, it just robbed me of my humanity. And so I was like, anybody that would talk to me as if I were a cancer patient, and that's how I was identified. And so she started taking up art, and then actually got pretty good at it. And then all of a sudden she became being identified with an artist. And she said, it gave me an entire new prospect on life, an entire new quality of life. And so I think those things are extremely important. And I can tell you firsthand, for me, I mean, I've got all kinds of different little physical aches and pains. I've had shoulder surgery because I had a car wreck and I had to have surgery on that. And I've just got different problems that you get when you get older. And then I noticed that when I go out and paint, for how many hours that may be, my mind is completely on that work of art. It's just like, and then when I'm finished, I'm going like, well, I didn't have any pain. I didn't have any pain. I didn't have any.
Think about it.
No, I mean, you are completely gone for whatever period that is. And that's what people are discovering during art therapy, is they're saying like, my nausea got better. I've been on chemo and had been sick, but when I was creating art, my nausea got better. My pain was not as bad. So it takes your mental focus away from that pain and directs it towards the art. And I think that's extremely important. And
especially in follow-up care, as you were saying, with insurance cards, and as we've said just before, the cost of healthcare globally is about $12.4 trillion a year. Now think about that, $12.4 trillion. That's globally the money that's spent on healthcare. And how much not just big pharma may not be thrilled, but with insurance companies, with Congress and say we're always looking supposedly for ways to help Americans save money and stay on track with like out-of-pocket expenses and co-pays and all this. How much more beneficial is it that not just are you saving money while you're in the hospital, with decreased length of stay, less, medications, which can run, ridiculous per day, depending on the type of medications you need. But if there's an ongoing therapeutic value and way to pay for that cost or supplement that cost, even if it's 6 months, a year down the road, the patient outcomes in the long term have got to be better because you're not hitting your insurance up for, maybe new medications, additional medications, because you're not doing anything. And, a lot of insurance will pay for therapy sessions, they'll pay for, so don't get offended here, my friends, especially the ones I know, chiropractors, they pay for all these guys, for ongoing treatment, so many a year. Art therapy should be right there with that because that, as you said, these double-blind studies need to be done because I think as Americans and as the globe stresses more as far as a population, there's got to be some outlets out there because right now the temperature out there with the general public, a lot of people on edge. In the USA, it's a political year, so there's an election coming up. Both sides, may just see black and white and that's it. There's no gray. And, we have that with our national leaders. They can't seem to come together once in a while, but the majority of the time to forge something that's united. And this is something with art therapy that everyone should be able to unite behind because everybody knows somebody that's gone through something. You're either coming out of something, going into something, or you're in the middle of something. Yeah. And I'll quote that from Dr. Jason Pettis, my minister, who we love to death, but he says that about every Sunday. You're either coming out of, going into, or in the middle of some type of valley or trauma. So, or a family member that you're close to.
It's just called life.
Yes. But, how you deal with that and the things that can supplement you, I'm not saying replace prayer because that's obviously, for me, that's the biggest thing. But creative ways to express yourself, like Steve said, takes your mind off that for a while. For some people that might be, creating by woodworking, maybe sculpting, maybe we big in the Appalachian area, so quilting, pottery, whatever that might be, sketching and drawing. You don't want me to do any sketching or drawing because then it will look like something at Sotheby's or Christie's because it'll look like some mentally insane person drew it that was locked up for 30 years. But
well, think about what you said. If you said the cost of healthcare is 12.4 trillion, just think about what the 0.4 is.
Yes.
Fair amount of money.
That's right.
Right there. So it's really incredible. And the other thing too is that everything that happens has some sort of ripple effect. That's just life. Everything that happens, there's going to be some sort of consequence. Mm-hmm. And just for example, art therapy has shown to decrease hospital readmissions within 30 days. And that's a big criteria looked on by like joint commissions and things like that. And, you as a physician are monitored by that because like all of these different committees, I was chief of surgery. And so it's like all this data is coming in to like me in regards to other doctors and their performances and what's going on. And one of the things that red flags is just like, a hospital readmission within 30 days. It's never good.
Those instruments are expensive. They got to get it back out.
I never did that.
I understand.
I never did that. but anyway, it's one of those things where I think that, when you look at that, that's how hospitals get accredited versus maybe not accredited, which is a big deal. Mm-hmm. Because all of that, a hospital that loses their accreditation is just a kiss of death. Mm-hmm. In regards to insurance payments and all sorts of different things that can happen to you. So there's a lot that goes through all this, and I'm going to be so bold as to say this, is that I think once instituted, and we are going to be sure that it's going to be instituted. And it's going to be part of usual and customary care.
Thank you.
Yes, the thing I'm going to say this is that I fully believe and I know that art therapy can help this opioid crisis. I have no doubt in my mind. Because if you're into art and you start really kind of like creating it all the time, I really believe that's going to take away some drug dependency.
Because that becomes your addiction.
Yeah, it does.
A good addiction.
A good addiction, yes. And to me, I just look at it like, and I've mentioned it before, creating art is absolutely wonderful, but there's nothing like selling it. And so one of the things that I want to see is like whether it's an adult or whether it's a child, for us it's, we're extremely happy that anybody gets a positive result out of what we're doing.
Right.
But can you imagine, like, if you're a child and you're going through a severe illness and your parents are going to be so stressed, that sort of thing. But could you imagine like how great that child could feel like he or she creates a piece of art, and then that art sells, and now that kid is a selling artist. I mean, so that is going to bring a level of happiness and satisfaction that I think it's going to be a lifelong change. I think that will be a lifetime change, because now you're a selling artist, and that's what we want people to experience. That.
Absolutely.
And there's a lot of art that's created, and then once it's created, what's done with it, a lot of it's just thrown away or
put somewhere and never seen again.
Exactly.
In a box or something put up in the attic, in the garage, the shed, wherever. And speaking of that, about according to Crown Counseling, was reading some information they had on there about, which is basically the same information everywhere. They just organized it, I think, a little better. To date, over 650 million people have been affected and benefited from art therapy. So that's a lot. And currently there's a little over 5,000 art therapists nationwide, which tells you that that sounds like a lot, but there may be more that are needed. And so like Steve said, we're on a mission to make sure that not only is art therapy become
usual and customary.
Thank you. I kept saying ordinary and customary, and he kept looking at me like the Riri I am. But that usual and customary becomes the standard quicker rather than later, because I've seen it in my own life through family members. I know Steve's seen it, for decades as well. And there's just something to that. So like Steve said, we have put our platform together to allow not just the art gallery, but some other areas, and we'll be going over a whole podcast where we have created a model to not only save money and to help, but the model also basically covers from beginning all the way to the end and beyond, so that there's a complete package for everybody. Because there are some organizations that do some wonderful work, don't get me wrong. I think everybody piecemeals things because that's the environment and the structure they're under. And a lot of them are very proprietary and understandable. Everybody's got the best program in the world, they believe, but it's all very proprietary. But why can you not just come together, put everything as a more standardized, not saying how you should run your program at your facility, but a standard operating procedure, for everything, so that you don't have to worry about this area. You can a la carte some things if you need to complete your program. So maybe you only need, a gallery and Steve and I have a proprietary social media platform for both children and adults that'll be coming out, and we'll be doing a podcast on that, which focuses on the art community and people who are into art and their families. And so those things together will take the isolation from being in the hospital, or maybe it's a child in a cancer ward, maybe it's an adult or a senior citizen, where they're at a facility or assisted living, and they have some, communications with others. But if they can learn to do things digitally, which, that's the whole world's going that way, We have some of our blockchain technology that's mixed in with it. It will allow people to not only create and express, but to share that with family members. And I know people say, well, what about you got, YouTube, Twitter, Instagram, TikTok while it's still around, and all these. That's great. All those focus one area, but what Steve and I have done, and I won't go into too much, but this is something, one, it doesn't track you, and two, it has total control from the matriarch, patriarch of the family over the children, and who else is allowed to communicate with not just the children, but the adults. And that may be other children, maybe other families, whatever. So it's specifically for, and it's a really, really long process to make these things come to fruition, but we've been working on for several years. So we're really excited about bringing that podcast to you. But getting back to this, if you figure that 650 million people have benefited, which sounds like a lot, but that's since its inception, art therapy. How many people globally have been to the doctor, or maybe you're home and it doesn't have to be a hospitalization stay. They could say, especially during COVID at that time, okay, well, you've got such and such, so you've got to be restricted. You can't be out in the public for 10 days or 30 days. I want you to be off and around people, whatever the case may be. Using art therapy, whether it's through a telesystem or whether it's a in-person, as Steve said, I think it's going to change the world. And that 650 million should go to about 6.5 billion.
Yeah, I mean, the thing about it is, for us, just about entirely without any exception, if you are a human being, you at some point in your life are going to be a patient.
Mm-hmm.
It's just that simple. And you think like, well, I take great care of myself, and I've got like years of great health and that sort of thing, and just like, well, that can be wiped away pretty quick.
Mm-hmm.
And a perfect example for me is that, I was just happily riding my bicycle out in the country, and then, long story short, one car crowds me a little bit, the other car's coming to the other lane, and I scoot over, then I hit a patch of gravel that was not seen. And like for that brief millisecond, I'm airborne. I'm just airborne. And I'm going like, this is probably gonna hurt. And so, and I'm doing all this, like, I'm riding my bike because I love it, and it's good for me, mentally and physically. I keep myself in great condition, for that matter. But during that time, it's a whole story to itself, but it's kind of funny. But I broke my hip, and I cracked a rib, and had all the skin torn off my right arm, and it was profusely bleeding. So I'm in a ditch, and like the only difference between me and like this possum is just like I'm the one with a helmet. And I'm just going like,
and Speedos.
Yeah. And I'm like, well, I was like, the first thing I have to do, I've got to take care of the bleeding. So I take off my jersey, and I wrap my arm, to stop the bleeding, because it's rather significant. Because I could see a vein there that was just pouring out blood. I'm going like, well, I got to get that fixed. Yeah. So got that fixed. A guy pulls over, a nice gentleman. He pulls over, and he looks at me. He goes, "Can I help you?" And then he starts to get sick. And so I just said, like, don't worry about it. I'm a surgeon. I'll take care of myself now. I got to take care of you. Just go over there, sit down in your car, put your head down between your legs, just take good deep breaths. You'll be okay. And I was like, well, I don't really feel that bad. I think I got this adrenaline rush coming here. And but then when I tried to step out of the ditch, I could hear the bones go together, kind of crack. And I said, like, that's broken. So the whole point is, you can be in great health.
Mm-hmm.
One thing happened, and like that, now you're a patient.
Yep.
And now
life changes.
Yeah, you're a patient, and you're a patient for a while. And whether you like it or not, you're going to have to deal with that. And so all of us are going to be patients. Mm-hmm. And the VA, the way that it's set up, my father, he's 95 years old, and he was stationed in different places throughout the world in the service. And one time he had been in the hospital in Puerto Rico, and one of his colleagues there, or one of his fellow servicemen, they were in the hospital as well, and they were drawing at the time. And he just said, like, well, what are you doing over there? And he said, like, well, it's just part of my therapy, and it really helps me. And that was in the 40s. And so the VA has had a handle on this to some extent for some time. And I think it's time now that the private sector catches up with all of that and puts it to use, because we have to look at it as more, not just giving you drugs, operating on you, getting you better, than getting you out. We have to deal with what's going on inside your head as well. I think that's just part of holistic care. And I think we do the other thing, I think, better than anybody in the world. As far as like when people have to have surgery, a lot of times, like when you see it, like Mick Jagger came here for his heart operation, and you see all these superstars in sports, they come over here a lot of times for surgery, and they do it for a reason. It's because we're the best at it. But we can get better, and that's by treating more of the whole patient. And I think that that's something that's going to become more and more prevalent as we advance, and it should.
And like you said, with the models you guys created, and I'm jumping into, so is what happens if you expand. And so we're going to be expanding Steve's model out, and the PhD that helped him, to include what happens, because the faster you get somebody back on their feet, the more mentally stable they are, and the more they're not depressed or anxiety or whatever it might be. It's productive for society as a whole, because you have a nation that's just not getting sicker and sicker and sicker all the time. You got a nation that is healing quicker, that can get back to work quicker, so that saves employers time and money, can save from overtime costs, can save from unskilled people trying to take skilled people's work because they don't have anyone to fill your position. So there's a whole collateral experience that needs to be considered, and that's why we are so strong on pushing this, because there's a mass shortage of skilled workers in the U.S., and it's just going to be increasingly so. And so if there's something that someone's out for a short time, but like Steve said with his dad, if there's somebody sitting there, that person's drawing, that person's writing, journaling, whatever it might be, sketching, they got toothpicks in there building something that don't matter,
Art is art.
Art is art, and, crocheting or quilting from their bed, if you don't know.
Hey, whatever works.
Hey, whatever works. I remember my grandmother, when I was real little, was in the hospital doing some like crocheting something. That was eons ago.
She was a pioneer and didn't know it.
Yes, she was a pioneer. And it wasn't pioneer days, I'm not quite that old. I'm getting there, but not quite yet. But it's such a vast and wonderful program. That's why we're going to be doing several podcasts on it. And as we come back into the next podcast, we're going to continue the discussion. We're going to actually hopefully have a couple of guests, and we want to give it time so that people can give their feedback and ask questions, and we'll actually answer your questions online, and we're going to be getting some statements. And like I said, we're already working with organizations to get this started and get this underway, who are already utilizing art therapy, and we're hoping to expand the programs and go out. So what we're hoping to do is come and make a major announcement for that, and something that can work for everybody. But we're also we're going to be contacting all of our congressional leaders, all of our representatives, and we're putting we're hoping to meet with some in person, some maybe through Zoom, some maybe through email, but we have a standard set of questions to get this so it becomes
usual and customary.
Thank you, Steve. And for those that respond in a polite way, but don't feel it's necessary, we're going to know that. But the ones who are helping, we're going to help promote, and we'll name who that is. But I'm just letting you know, if you are a representative, whether it's here in Kentucky or any other state, and we contact you and you blow us off or give us some kind of raw answer that you're not interested and don't think so, you will be mentioned. Let's just put it that way. So, because Steve and I have no fear, other than from our wives. That's about it. So, Steve, you have anything you'd like
Well,
to?
one thing I'd like to say that this has been used, and just to give you a range of where this has been used successfully. You're looking like surgical patients, pediatrics, geriatrics, burn patients, patients with Crohn's disease, diabetes, chronic obstructive airway disease, cardiovascular disease, stroke, especially like in stroke, trying to get their mental capacity back. But one of the things that we can cover a little bit more going forward, but I think it's important to know is if you look at like Alzheimer's and dementia, that sort of thing, art therapy has been shown to increase neuroplasticity in the brain. And so it not only has a treatment element to it, there's a prevention element to it. And so I think that's extremely important, because if someone is affected by one of those disease processes, and I mean, if you can obviously put it off forever, that would be great. But even if you could delay it by years, those are years that are very precious years with you, your children, and your grandchildren, that sort of thing. So there's going to be a place for this, not only in the treatment of disease, but prevention of disease, which I think is going to be extremely important as well. And so what we are trying to do is make art therapy usual and customary, and just put it all over the world, and let the world know this has healing properties that must be utilized.
Absolutely.
Yeah, and that's all I have to say.
Well said. Yeah. We will see you at the next podcast.
Thank you.
Have a great one.
Thanks for listening to the Dr. Franken Steve Podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.